Evening. Give 1 or 2 minutes as always. See one in here. Hello. Hope you all had a good day. Okay. So today we're going to talk about returning to play. Um, I've named it as the do's and don'ts. So there's a whole lot of theory behind um, what you should be able to do before you return to sport. But I've sort of condensed it down into categories of do's and don'ts, which I believe are the most important points that we need to cover. Um, I'm going to be positive and start with the do's. So, um, first, we sort of need to understand what returning to play is. So, within rehabilitation after injury, there needs to be that point where, right, when are we going to make that decision and how are we going to make that decision um, to go back to playing our sport? And we need to understand what it takes for us to be able to play to a high enough level. So, when when we think about the do's, the first thing that we need to do is we need to think about what we require for the sport. So we call that a needs analysis. So you're going to analyze the specific requirements that your body needs for your desired sport. If I was going to use rugby for an example, there's multiple elements that you need within the sport to perform at a high enough level without risk of injury. So strength, power, speed, cardiovascular fitness. So how you need to play for a full 80 minutes plus. Um, can your body meet those demands? But also, what's most important, arguably, is psychological readiness, especially for a sport with rugby where it's high contact. You need to get yourself right in the mindset to do that. So, point one is analyze the needs of your sport, and that's before you do anything else. That's why it's number one. Second of all, is you need to have a little think about your clinical condition. So, one, what we once we understand what we need, we have to think, okay, are we actually there? Do I have the strength? Do I have the power? And that's what the whole purpose of that rehabilitation is. So, if you're able to go from early to mid to late stage without any hiccups, or you've completed that with hiccups and you feel like you're now ready, may have taken you a bit longer. But we know that within the mid stage of our rehabilitation, you're thinking about strengthening the gym, basic motor control, patterning, proprioception, which is the live I spoke about last week. And then once you've gone past that, the late stage is more targeted towards a little bit targeted towards the things that you need for your sport. You need to recondition your muscles. That's what the late stage will be. And then once you're ready for that, then you're ready for returning to play. Not before. You have to make sure that you ticked off every box and made sure that your body is ready condition wise. So second point is clinical condition. Third, we've got we need to progress out. This is progression is probably the most talked about word within physiotherapy, and it's something that you have to adhere to and make sure that you're not skipping any steps, but at the same time you're not stagnant. You have to go from A to Z at some point, and you have to get to Z. But how do we do that? What's the way that we do that? Is through progression. Each step increases load, increases strength, increases the volume. All those aspects we have to increase. But when we are thinking about rehabilitation in just a clinical environment, or just at a gym, that's not the same as when you're out on the field, right? Or whatever sport, well, field, court, whatever the sport is, you need to go from the building blocks to build up to that. And one example of that would be if you think about the movement required for a sport. You're going to start off with linear movement, just A to B, nothing special, just in a straight line. Then you're going to change that to, right, what does the sport rugby need? It needs you to be able to, take a pass, move in a different direction, or you need to be able to change the direction or to make a tackle, run past someone. So you're taking that dead straight movement, changing it to multi-directional. You're then thinking about, right, I'm not just moving in zigzags or certain directions, I have to react. So there's reactive movement, and within that reactive movement, there's the sport technique. Now we're getting towards the sport itself. There's the technique of the sport. Then there's sport-specific movement. For example, with rugby, you have to get down low for a tackle, get your shoulder involved, get your neck out of the way, get your head out of the way when you're making a tackle. That's a specific movement to the sport, whether that's cricket or hockey, dribbling, that involves specific movements and skills. So you need to restore the skills that you've lost previously. When you've got that in your locker, you're then going to simulate training and then get yourself up to match fitness. Once you've done that, so we started off with linear movement, then we moved on to match fitness and training simulation of what you require in the match. You've now successfully bridged the gap between off-field and clinical rehab to on-field rehab. So when you are returning to sport and making sure that you're following the right protocol, you're going to prepare to train, which is on-field rehab, and then you're going to prepare to play. So those are two separate things, right? As soon as you've prepared to train, you've trained, you then need to be able to prepare to play. So each of those points are progressions. Each of those are following a continuum, which is step-by-step process, and that's important for you to get yourself prepared. Following that, right, you might think that you're ready, but you then need to put it to the test. So that's where us as a clinician will do, and us as physios will do. But you within your own time and within your own sport, if you don't have those facilities available to have someone to train you, then you can test yourself. So you need to think about, like, when am I going to test myself? Test yourself when you're ready. You're going to test yourself before joining a new training environment. So don't if you've got not used to a specific sport team, or you're trying for a new sport, or you're going back to a sport after a long time and it's the environment's changed, you need to train before that, get yourself ready for that. And then if you're thinking about most sports have some form of contact, so you're going to return to non-contact before you return to contact. Once you return to contact, you return to match play, and then after that you're thinking about pre-season, for squad selection. That you're going to test yourself as well before that, so that you're ready. So testing ourselves is some of the best ways that we can get ourselves better. So when you do test yourself, it's going to tell yourself, right, can the athlete do their sport effectively, without breaking down at a certain intensity? Can you do it with adequate skill? Can you do it for long enough? With no additional risk to injury. Um, is this in context of the injured area, and are you thinking about this in the short term or long term? So all these tests should be able to answer each of those questions so that you can go in confident, knowing that you are 100% ready. But what you might be thinking, so what would a test look like? So you need to be able to test all the parameters of the sport safely, and the needs analysis that you've done previously. So what do you need for the sport? You should then be able to deconstruct the requirements and produce a series of tests based on that. So, for example, with someone going back to the contact, you get them to hit bags, which is like simulation of a tackle, and it then assess your competence in a tackle so that you don't get injured in that tackle that you haven't got injured in previously. So you need to understand the progressions that you need to be able to get back to testing, and then understand the process that you need in order to test yourself. So all the equipment that you need, sort of what sort of speed you need to be going at, how much strength you need to be putting into this. Game readiness as well is something you can test. So are you prepared mentally for the contact? Are you prepared mentally for the intensity? And that's sort of a way that you can test the ways that you need to test yourself is based on that. So that's point 4, testing. Once you've done the testing, once you feel like you are, okay, I think I'm ready, you need to make sure that once you're back, you are monitoring yourself. So within every sports team, there'll be data that they need to look at. They'll be looking at their heart rate. They'll be looking at their speed, everything like that. Those can be distributed into internal load, which load basically is how much strain are you putting on the body. Internal load basically is measuring things biologically, so your heart rate, immune response, hormone response, and internally it determines the stimulus needed for you to adapt, right, within yourself. But there's also external load, which is your total distance ran in a game, the highest speed that you ran at, and then if you're thinking about within a gym environment, it's to measure external load. You're thinking about the sets, the reps. Those are that's what load is. It's data that you can collect, and this is important for you to sort of note down for yourself and say, right, I was able to play 70 minutes in training. That's not enough. How can I get myself to get better in that respect? How can I get my fitness up? Then you go back to square one, train more. That's why it's important for you to monitor what's going on. Okay, so now we know the do's. So needs analysis, check your clinical condition, make sure you're progressing, not staying stagnant in one place. You need to test, and you need to make sure that you are monitoring the entire time. So now we know what we do want to do. So what in there is something that we need to make sure that we avoid. Number one, it's we want to avoid having a negative, or what I'd call a red light approach, which means that we need to allow ourselves to progress, unless you see a reason not to. Don't take the approach that you can't do something. Take the approach that, if I am struggling, I'm going to push myself. There's less chance of you getting re-injured if you're less tentative in doing something. So go for it, push yourself, but obviously within reason. But don't have a negative approach of I am injured, because you've had those you've had those sessions, you've had those weeks and weeks of rehab. You should be ready at this point. So don't think that you can't do something as a result of injury, right? A second don't, which is something that you have to try and coach yourself out of, is mimicking the qualities of the sport. So what I mean by that, imagine if you're a cricketer, you don't just go out and just practice bowling like in a mimicking way. You have to strip down each aspect of a bowl. What's the technique that you need? Take it step by step, each phase, and work up to things. Um, Rehab training is adaptive process. You need to make sure that you are able to change things around. Don't just copy things um, one after another. Make sure that you're doing things and adapting to what you require. Don't just copy what other people do. Do things based on what you require. Third point, which is sort of an opposite to like the red light approach, which is overloading. So on the opposite end of not doing enough and not thinking you can do much, there is the case that you are doing too much, and that's why we talked about load before. Um, Monitoring load will make sure that you don't do this, but we know based on research that athletes will generally respond better to gradual increments in load. So gradually increasing the amount of um, work or training that you're doing to around about, you want to do about less than 10% per week, but that will eventually get in due time, get you past that 10%. You want to prescribe the load, so you want to prescribe the amount that you are putting your body through on an individual basis, especially in team sports. You want to be able to don't do the same amount of training that those that aren't injured are doing. Do the amount of training based on what you need to do. If you have been injured, you might need to step it up compared to people that haven't been injured, and you need to take that in mind, because these other people don't have to do as much as you do because you are the one that's injured, not them. Um, there's variation between each player, of course, and you might be, for example, let's say rugby and you're a forward, you might have to do things differently to a back, but you have to develop in the same in a way that represents you and not anyone else. When we talked about having mental readiness as well, so psychological load needs to be taken into consideration. If you are training often, it can take a toll on your mental health. So make sure that you're not overloading in that sense as well. Make sure that you are taking the time that you need to process and comprehend what it takes to get back, and don't rush that. It's important not to rush that. That leads me into the fourth point, which is what you see people do a lot is don't give in to fear. So it's a significant problem in injured athletes to neglect what it takes mentally to get yourself back in. But at the same time, there's a high amount of fear of re-injury. There's a fear that if you get yourself into a similar situation that you were injured in the first place, that you won't be able to cope with that. But remember, you've done the work to get yourself to there. So don't give in to that fear. You shouldn't have that fear if you've had a clear plan. You're meeting a time scale. So if you know you have to get back within 3 months, you've been working within enough time to do so, and testing yourself consistently. If you do all of those things, you're prepared. And if you're prepared, you shouldn't have any regrets or fears that you're not going to get yourself back up to standard, or even beyond standard that you were previously. So the don'ts are: don't have a red light approach. Green light approach is what you need. Just go for it. If it doesn't work out, then you've done. If you're struggling, then obviously you can always regress. But it's easier to just to regress than it is to step things up. So don't have that approach that you can't do anything. Secondly, mimicking. So don't just copy what others do or what the sport requires. Adapt, change based on what you have. Thirdly, don't overload yourself. Small increments, gradual and controlled. And finally, don't give into the fear. So when you're getting yourself back into to return to sport, have those things in mind. When you are just on the tail end of your rehab, make sure that you don't jump straight into things. Have a think about what I've mentioned, the steps that you need, and follow those through, and you should be returning to your sport in no time. Okay. Thanks a lot for coming, guys. I'll leave a couple of minutes for questions, if I see any. Okay. All right, leave a comment if you have any questions, and I'll get back to you. Thanks for coming for live, and hopefully that you've learned quite a lot from that, and see you shortly. Bye.